Hi, my name is Cara McCormick and I'm an integrative therapist here at the Mid-Ulster Clinic. Integrative therapy comprises of the three main approaches to psychotherapy: person-centered therapy, cognitive behavioural therapy or CBT, and psychodynamic therapy. Within session with each client, I draw on these three approaches to tailor a treatment for each individual client. People should see an integrative counsellor when they feel overwhelmed and when they can't emotionally regulate. In other words, whenever you feel overwhelmed on a daily basis or frequently, like not always, but it can be, like even every few weeks. And this is normally when we're triggered by stimuli. People don't look at them as triggers, but when we're starting to feel overwhelmed, or when I say overwhelmed, like we all self-soothe some way, but when we just can't, when nothing else is working, if we're having a bad day at the office, we're having a bad day at work, we can usually, regulate emotionally when we get home, when we get somewhere. It's whenever we leave the office and we get home and we still feel the same. There's no way out. Whatever's going on in here psychologically, internally, trauma shows up in our body as well. It really does, in somatic effect, and it's recognizing and noticing what is going on. So this is when we typically will see somebody. It's usually when we are extremely overwhelmed, and that is through feelings of anxiety, depression. The thoughts is huge. The irrational thinking, the ruminating. That the compulsive. Just these thoughts that are again ruminating thoughts. The low mood. We can be hyper aroused or hypo aroused. The hyper is your anxiety. That's the constantly needing to do, constantly needing to run. Then you have the hypo is depression. That's the numbness. I can't, the flatness, the apathy. I can't really do anything. Every day I feel low motivation, extreme tiredness. It's noticing that in ourselves. And it's the fact that we just cannot do every day. Then you'll seek a therapist. Treatments that are available within the clinic are person-centered therapy, cognitive behavioural therapy or CBT, and psychodynamic therapy. Person-centered therapy is a client-led therapy. What I mean by that is the client is in charge in this room. The client, it's primarily a talking therapy. It's quite reflective by the therapist. The person's in charge in that room. Possibly for the first time in their life they have a voice. They get to speak, they're in charge, they get to say this is what and the more they talk, they find their own solutions to their problems. That is the premise of person-centered. This can be very empowering for that person. It gives them autonomy. It gives them empowerment. It gives them their self-effacement, something they never maybe had before in their lives. We are more of sounding boards in that room. Obviously I play a part, but for this person, this can be really, really empowering in their lives. So the most thing with person-centered is it's client-led in the room. CBT is a goal-orientated approach to psychotherapy. It's a talking therapy, and it's collaborative, but it's very directive by the therapist. There is homework involved by way of worksheets, thought record worksheets, journaling, and it's something that the client really needs to lean into. It really does. You need client participation, so it's something you have to be prepared to do CBT. Within CBT, the premise of it is to look at our thoughts, change our behaviour, and we are governed by those thoughts, whether they are negative, pervasive, they are challenging us every day, and that's usually when we come in. So CBT is primarily change our thinking, will change our behaviour. So to lean into that, you need to do the worksheets. You need to, and it's also a talking therapy. So what we do is we will look at the past. We're not going to stay in the past. It's not looked at in depth. It's a here and now structure. It's a here and now, and it's very, very logical. It's something we have to It's wordy. We like, the worksheets. It's a really good structure for some people rather than just having the talking therapy. Psychodynamic therapy, it's a longer term. It looks at our past experience. It looks at how those unconscious biases and those unconscious motivations that we learn from childhood, they're showing up in the present. They're showing up every day in thoughts, feelings, behaviours we are not aware of, but we're aware of how it's making us feel. Depression, anxiety, irrational thinking. You can see how it coincides with other approaches, but on its own, it can stand alone because it is in depth. I am taking you to childhood. I am taking you to where this is from. We are tapping into the unconscious. What it does for a person is it brings them into the here and now. Because when we are triggered or when we are taken to that past from our stimuli around us, from our five senses, that's when we can't cope. That's when we need to come to therapy, and we don't know why. But when I look at your childhood, or it can be lifespan, it can be childhood, adolescence, and it can be something trivial, or it can be a here and now. It can be just like a one incident. It doesn't have to be a developmental, it can be acute. But what we do is we will look at that on the client's terms. We will look at that and update it to now. What they leave with is increased self-awareness. They will know their triggers, they will know where they are, they will know it's like seeing the bus before it hits. It's like, I will know myself. And we don't forget this stuff. Trauma doesn't leave. What it is, I try to stop it showing up in the present. It's like I can recognize it and I have a handle on it. It gives me some control back in my life. It gives you that psychological growth that most of the approaches give. But for me, that one is, if I know, we all have a past. Every single person has an upbringing. That is what you're living right now. That needs updated. And for people that have ACEs, like adverse childhood experiences, they are showing up in the present. And that's the people that need therapy, if you like. But with psychodynamic, to me, it's that uniqueness of self-awareness. If I know me, then I can manage my life now. And with trauma work, trauma's ongoing. Trauma shows up every second. You've stimuli around you every day, and trauma is ongoing. But if I can, it's like making the then and there, here and now. It's in your life every day. Those people, whoever, the caregivers, they're showing up in your life today. We need to put them in the past. When they're in the past, that's what there's the work. That's the trauma work within psychodynamic. I work with adults 18 years and over, face-to-face in clinical practice. I look forward to working with all my clients and future clients here at the practice.